Hello, this is Anita Browning, and I am with the Mid-Atlantic Telehealth Resource Center. I wanted to welcome you to our webinar today. Webinar today is about Delaware Libraries, Telehealth, and Teleservices initiative. So the question is, how does a Boston-born chemical engineer go on to launch the first statewide telehealth initiative for public libraries? I would like to introduce you to Nick Martin and begin to answer this question. Nick Martin is a chemical engineer by training who has found his passion at the intersection of emerging technology and social impact. Prior to his current role, he spent several years in the nonprofit space, which included helping build a Delaware-based K-12 STEM outreach organization. Nick's research background in renewable energy technology most recently led him to receive State Department funding to create a solar energy community center in a slum outside of Lagos, Nigeria. Nick currently serves as the telehealth coordinator and emerging technology consultant for the Delaware Libraries. Today, he will describe the current deployment of a telehealth and device loaning initiative that integrates into existing public library infrastructure. Welcome, Nick.
Thanks, Anita.
Certainly.
Do we need a few minutes?
I wanted to reiterate also that we will be recording this and the recordings will be available afterwards. Go ahead, Nick.
Looks like I'm popping up here twice. Okay, well, I'll go ahead and share my screen. All right, so thank you everybody for joining today. Again, my name is Nick Martin and I am the Emerging Technology Consultant for the Delaware Division of Libraries. My role expands all sorts of emerging technology, but as it relates today, we're going to be talking about this telehealth and teleservices initiative. I am joined by Dr. Vishal Patel, the Associate Medical Director for the Center of Virtual Health at Christiana Care, and I will give him a little intro and bio towards the middle of the presentation. So to begin, I'd like to start with a little PSA. And let me know if you can't hear this. Hi, I'm Nick Martin, Program Director for the Telehealth and Device Loaning Initiative with the Delaware Libraries. This program started several years ago, actually, when I came on board as an AmeriCorps Vista with the Delaware Division of Libraries. And at that time, my focus was on emerging technology as a whole. This includes artificial intelligence, virtual reality, and as it relates to today, telehealth. But what I quickly realized was most of the needs came in terms of healthcare access. We have, as a library system, a strong partnership with the Department of Health and Social Services, and prior to COVID, we had social workers in almost all of our libraries. And my next step was to actually travel to almost all the public libraries in the state and talk with the managers about what telehealth could look like in our libraries. Little did I know that a few months after that roadshow, we would enter into a global pandemic that really highlighted the importance of quality healthcare and broadband access. What we realized next is we needed private spaces in the libraries. And since the libraries are so heavily used, including the study spaces, we needed standalone spots where patrons could frequent to access these basic health and human services. So that's how the telehealth kiosk came to be. As it stands today, the kiosks can hold 2 to 3 people inside, have HEPA filtration, UV sanitation, and are equipped with iPads and can access a variety of platforms, including Skype, FaceTime, Zoom, and several telehealth specific platforms. In addition to the kiosks, we also hired staff that we're calling navigators, who are people to assist patrons in all parts of the kiosk process. And that includes scheduling, assistance with the technology inside, and also the follow-up in the case management of each patron's specific needs.
Hello, my name is Maria. I am a navigator at the Seaford Library. I am located next to the kiosk. We offer Chromebooks, WiFis, and services for social service. I help with scheduling appointments. You can walk into one of the 3 libraries, or you can go on the website getconnected.delawarelibraries.org.
We don't want that again. So that's sort of a depiction of everything that's happening, definitely with a focus on the kiosk program, but I'm going to go into all parts of this teleservice initiative. So the initial motivation for this project came from a behavioral health access standpoint. When we look at in Delaware, the increase in depression and drug overdose deaths, and this was, I believe, 2012 to 2017 data, it's pretty astonishing. If we compare that and overlap that with the lack of mental health specialists in many parts of our state. So I have this little heat map here of number of mental health specialists, full-time equivalents by census county, and this was 2019 data. Lower parts of our state and the southwestern parts of our state do not adequately have mental health specialists to support the needs there. Then all of this combined with the lack of access to internet and devices. So this is statewide data. About 16% of Delawareans do not have access to the internet, and about 10% do not have access to a computing device. So then we look at where we stand as a library system. And I found this interesting Pew Research study that affirmed that libraries are universally valued for accessing healthcare information. In fact, 87% of respondents affirmed that the libraries were at least somewhat useful in seeking this information, seeking health information. So I also have this picture here of a last year edition of the Delaware Journal of Public Health, which was featuring the intersection of public libraries and public health, just to show that the Delaware libraries are considering how they play into public health and providing resources to the public. So the question that really launched this initiative was, how can we continue to meet the needs of our patrons as a library system during COVID-19 and beyond? And we're still in the during COVID-19 part. So the first part of this initiative are these kiosks, or these booths for social service that you saw in the little promo video. This is one of 3 kiosks that are located in the southwestern part of Delaware. While the initial focus was behavioral health, you'll soon see, based on this conversation and when Dr. Patel comes, that there's more than just behavioral health we can do in terms of healthcare, but we can also offer wraparound support from a legal perspective, employment support. It's a soundproof, multi-person capacity private space in the library that's connected to high-speed internet. So you can imagine that can be used for a variety of social services. As you saw in the promo, we are staffing these kiosks with navigators, and these are people and these are staff that are positioned right next to the navigator to help patrons with all parts of this kiosk process. Like I said, it's currently at 3 rural libraries in downstate Delaware, and we are looking to expand. What's really interesting, and I'll talk about this later, are the surveys that we're collecting before use and after use of the kiosk, and some data that we're finding. And then this kiosk and other parts of this initiative are in collaboration with the Christiana Care Center for Virtual Health, which again, you'll hear about in a little bit. So to go a little deeper into the kiosk, and the reason I really like this manufacturer in particular is they focused on producing something during COVID times. So in addition to having UV sanitation, there is a HEPA filtration inside. We have a hand sanitizing station that we put outside the kiosk. We also, for added privacy, just put these, retrofitted these white noise machines onto the outside glass. And then to keep this really platform agnostic, we decided to just put an iPad inside that are preloaded with social service apps and teleconferencing platforms. So anything from Zoom, Skype, to telehealth specific platforms, but also the internet if patrons need to get into a provider specific platform. So the second part of this initiative, and this is something that several libraries have already been embarking on across the country, is device loaning. And this is in the form of Chromebooks and Wi-Fi hotspots. But we realized that device access and healthcare access, we would launch this initiative in tandem because they both support each other. So these, like our library books, are loaned out of the library to be taken out These devices instead are loaned out for 1 week at a time. And we aren't enforcing late fees, but there is a replacement cost with these devices. They come with the cases and unnecessary charging cables. What's really unique about the hotspots, as I'm sure many people on this call know, is they can connect to 14 devices. So one device can definitely support a family. And then what I'll talk about in the next slide is a new landing page that we created specifically for this social service access initiative that gets people directly linked to all of parts of this program, a new landing page for that. And then similar to the kiosks, the telehealth kiosks, we are collecting data before people check out these devices to learn about, is this their first time accessing a device? Do they have internet at home? So we can get a better picture of who we're serving. So this is the new landing page we created, getconnected.delawarelibraries.org. You'll see here that there are several buttons right at the top of the page to get to loaning out Chromebooks and Wi-Fi hotspots, connecting with telehealth and other teleservices, and then also direct links to our scheduling platform. So we also have appointments that you can make with social workers, with employment specialists, and then lastly, a direct link if you want to book time in the teleservice kiosk. And the third part of this initiative, and the newest part, is this traveling nurse. This is in collaboration with a grant from Highmark, Delaware, and Christiana Care. The focus of this nurse, which ties closely with the kiosks, is in southwestern Sussex County, the most southern county in Delaware. And I have these 3 maps here because I wanted to show the motivation behind that area. Not only is it a rural area, but if we look at, and I apologize if the text is a little small to see, but the graph on the far left there is looking at number of persons per primary care physician by census county division. And the white, the dark green are, and the light green are the lowest number of people per primary care physician. So you can see how that overlays into the next map in the middle, which is number of youth per pediatrician. And then finally, the last map on the right is looking at Delaware federally qualified health centers. And you can see in the most northern parts of our state, there's more dense, there's a higher concentration of these FQHCs, but in Sussex in the southern part, not as much. So taking that all into consideration, this traveling nurse initiative is really to look at some of the most underserved communities in Delaware, the uninsured, the underinsured, and really the estimated 30,000 undocumented immigrants in the state. So with that, I'm actually going to turn things over to Dr. Vishal Patel. Dr. Vishal Patel is a practicing primary care physician who serves as the Associate Medical Director of Christiana Care Center for Virtual Health. In his role, his major focus is to use a data-driven, innovative, consumer-centric approach to improve access, affordability, and quality of care for the community served. He and his team have learned a lot from management of COVID patients through virtual and digital technologies, and have used many of these lessons to create a holistic virtual center that takes care of patients through the care continuum. Vishal.
Thank you again, Nick. So it's a pleasure to be here with you guys. And I wanted to sort of continue some of the conversation that Nick was having in terms of, why Western Sussex, and just share a few other sort of heat maps. This is from a study that myself and a few colleagues have done. And the graph on the left for some of them, I think probably not pay attention too much to that, primarily because where I work is sort of in the northern portion of the state in Newcastle County, and that's sort of where the majority of our volumes have been in 2020, and in 2021 we're starting to see more throughout the state. But from 2020, and I think if you're just looking at a few key variables here, you can see that there's higher socioeconomic vulnerability in the Western Sussex area. So just another reason why this is an area for us to look a little bit deeper and provide more services. Next slide. And then the same area also, as you look at the graph on the right, has more homes without broadband access. So that ties back into some of the loan programs, and also just really the why behind why we're looking at this area. And also this area is more rural. So I think if you're looking at a lot of the, common social determinants of health, we know that there are barriers to care or, communities that are hard to reach in areas that may be rural, more socioeconomic vulnerability, along with areas with lack of broadband access. So just another reason why we looked at this area and as sort of a good sort of pilot area, and also to really demonstrate sort of and hopefully we'll be able to demonstrate the effectiveness of the impact of the work that we're doing. So I'm going to shift gears a little bit just to share a little bit about what we're doing at sort of the Christiana Care Center for Virtual Health and how this has helped some of the patrons that have been at the library, and how, this is really just phase one, and we're continuing to learn, iterate, and evolve from here. So we've sort of been a entity for, less than 5 months. Christiana Care is a large health system in Delaware. It's, $2 billion entity, not for profit, and has sort of 4 acute care hospitals, and then a number of outpatient practices sort of in the New Jersey, Delaware, Pennsylvania, Maryland area, but primarily clustered in Delaware. And prior to the pandemic, and then obviously the impetus from the pandemic, we recognize that there is really a moving trend to provide care virtually, and anything that can be virtual, should be virtual, and that sort of the new venue of care is the home. And the home could be, their physical home, but it could also be sort of within the community, their workplace, wherever it may be, so that it doesn't have to be within the walls of an office. So this is sort of like the reason for the creation of our center. And, some of on the slide, you could see some of the high level sort of attributes of why we've created this and sort of what we're able to provide. So it's obviously extremely convenient. We're accessible. We can provide care. I'm about an hour and a half north of these 3 kiosks. And, from my office, I can provide care to any of the patrons that are there. So it obviously allows for the ability to do sort of virtual visits. And, these visits can occur within the kiosks, but then over time with the providing sort of hotspots and other sort of things, it doesn't have to be during the working hours of the library. We can expand to providing coverage. Essentially myself or someone on my team is on call 24/7. And then we've have the ability to do sort of synchronous audio video visits, 7 days a week, as you could see on the slide here. And the other thing that many of you probably know from, either seeing either in person or virtual primary care is that it's really a team sport. It's not just, the physician or nurse practitioner. It's really multiple other key members of the team that takes care of the patient. And that allows ability to scale, but then at the same time allows everyone to work at sort of the top of their license. And, we've been able to take sort of the same key stakeholders, same individuals that may be in a virtual or in a bricks and mortar practice, and sort of created that for our virtual team, and have made some modifications in terms of what their key attributes and their roles are. And one of these roles is, the patient digital ambassador, and, has probably some overlap in terms of that care connector, or that connector that Nick sort of talked about earlier. And within sort of our delivery space, this person is almost like your medical assistant. So someone that's like checking you in the office, checking your vitals, reviewing your meds. Your office assistant, so someone that may sort of check you in when you enter there, take your insurance card, and maybe do some of the demographic and administrative aspects, and then also like tech support. And we found this to be a pretty unique, but very fulfilling and much needed role. They're really the glue between the patient and the practice. And this is someone that this is the most abundant role. And this is someone that the patient can reach out to. The patient has built a relationship with this individual, and frankly, probably 70 to 80% of the issues can be handled by this individual. And it helps all the other individuals on the team, focus on maybe higher acuity issues. So And I think, in terms of that role, I know there was a question in the chat, in terms of from a training standpoint, there's been some training that we've done internally, and then, we're working with the local university to really create a more structured curriculum, because we strongly feel that these sort of care connector roles are going to be critical in sort of the success of any delivery of care, just because it's not just one person on a team. So once we get more information about sort of what we've created with our local university, I'm happy to sort of share that more globally. Next slide. So there's just another schematic, of the people on our team. So I know I talked a little bit about the patient digital ambassador, and then obviously the nurses. So there is obviously the on-site nurses, sort of with some of the travel program that Nick mentioned. And then there are also nurses sort of at our centralized team that has the ability to, work 24/7 with that patient and their patient's needs. And really our key differentiator is really providing this holistic experience. And oftentimes most people are seeing their provider once a year, and we know that there's so many things that occur during that year. And, we have the ability to not only just do all the wellness stuff, but also anything from an acute care. So if you have an urgent issue that sort of pops up. And then lastly, really the big thing is from more of a wellness standpoint, because we know that, if we take care of one's exercise, nutrition, mental well-being, sleep, stress, then a lot of these chronic conditions won't occur. And I think that's how we've created this team, where we really want to focus on that sort of holistic biopsychosocial model of care, and are starting to, build out this team and really learn from our patients, and also from this new delivery of care of how we can best sort of optimize and get the best outcomes for the patients we're serving. Next slide. So we know that, the majority of the things can be done virtually, right? And I think there's Kaiser, Permanente, and a number of other sort of larger organizations have been at sort of virtual care for, almost a decade now, way before the pandemic. And, really the main impetus for us now being able to do this, and it's now a lot more common across the country, is, there's been some changes from a payment reform standpoint to make it easier to do this work, and also moving towards sort of value-based care, where you're paid based on the outcomes of your patients and their utilization. So you really want to focus on being able to be more proactive with one's care. So that's sort of why there's been this sort of shift. But we know that not everything can occur virtually, through sort of a visit like this or a conversation like this, that there's going to have to be some hands-on. And that's where, these community access points that we've created with, the libraries being one of them, but also within community sites and other places throughout the state, are going to be extremely important, and will be critical for our success, because it helps patrons with sort of assistance with connection to virtual care. We have the ability to do different on-site assessments. So there are other devices that can allow you to do sort of digital stethoscope, otoscope. So you have the ability to listen to someone's heart, lungs, ears, look inside their mouth. And it's really just another device like, the phones that we have that have, additions to that. So you have the ability to do other diagnostic testing. And some of this can be done directly by the patient. But, recognizing that, from a cleanliness, from a COVID and all that standpoint, we obviously have, individuals on our care team there. So either the nurse or, the care connector that's there to be able to sort of assist in doing some of these assessments. And then some of the other things, may not be able to get done physically within the library, but we have, mobile, we have a mobile van as well too. So depending on what event we're doing, depending on if it may be COVID testing, if it may be other sort of screenings, flu clinics, COVID clinics, we have the ability to, use that kiosk for, some sort of individualized one-on-one either counseling or conversation, and then have different immunizations and other things outside in the parking lot through our mobile van. So I think that this allows for a lot of flexibility. If you have, our team has a lot of creative minds, and we've been able to really challenge the status quo of like, what are things that can be done, directly within the community so that individuals don't have to take off from work. It's sort of embedded in their day-to-day, and they're able to access, without multiple sort of steps, and are able to get the care that's needed. So I'll hand it back over to, Nick, to talk a little bit about, what success looks like for us, and really what outcomes that we're trying to measure, and then sort of moving towards, what are our next steps in this sort of unique partnership that we have with the libraries to provide care to the entire state, especially focused on those that are in more vulnerable populations.
Awesome. Thanks, Vishal. So in summary, here are a few expected outcomes of this program. The first really being increasing access to remote health and human services. And we can really track that by the data we're collecting in the kiosk via the pre and post use surveys, and also via the devices in the pre-use surveys. We can also look at data about the number of people that are enrolling in health insurance, looking at number of job applications submitted, things of that nature. The second is really access to tech devices and Wi-Fi, and we can look at that just by the number of people that are loaning out these devices. I should mention that while I might have said this earlier, but while the kiosks are only at 3 libraries, the Chromebooks and Wi-Fi hotspots are statewide right now. We also hope, and this is inherent to telehealth in general, that there's a decreased lead time to see a healthcare provider. We do ask that in the post-use survey, how this experience has compared to a patron previously seeking healthcare. Because of COVID and just the way the digital age is progressing, we need to increase the public's knowledge of technology, emerging technology included. And that is a number of things like Zoom we're on now, but it also is looking at things like contactless payment, Instacart, things of that nature that maybe people are using in their everyday life now that eventually everybody is going to have to go toward. And then the last and sort of the selfish expected outcome is increasing the impact of the library to the community. In order to use these services, you do need an active Delaware library card. And we've already seen a huge increase in library card registrations just because of people using these services, which is pretty exciting. So then I wanted to talk about, because we've been at this for about half a year now, what we found and how we're iterating moving forward. So first we found is the library foot traffic is pretty slow in general. The managers that I'm talking to are seeing as low as 50% foot traffic as compared to COVID. So we have an issue of getting people into the library in addition to telling them about these services. So because of that, we're experimenting with some new marketing tactics. In addition to just exploring all verticals of marketing, so that includes print, billboard, radio, car wraps, we're also looking at incentive programs to get people into the kiosk. For example, a referral program. So if you refer X number of people, there's an incentive through a gift card to continue referring people. The next is, most people are hearing about the devices at the library. So when we ask how they're hearing about it, it's yes, there's some of this external marketing, but a lot of it is referring by staff inside the library and by just other library patrons. So because of that, part of my role is continuing to equip staff at the kiosk libraries, but libraries statewide, about how to talk about these services, and also attracting more people to just come into the library again so they can learn about what we're offering. We're seeing digital literacy is low, and that is in terms of just using the devices themselves, but also these new emerging platforms that are coming about as a result of COVID. So something exciting we're deploying is North Star Digital Literacy, which is a platform that is designed to give people basic skills needed to use a computer and an internet in their daily life, employment, higher education. It's sort of a rewards-based platform that is allowing people to learn about new technologies and new platforms. And then I already mentioned this before, but educating the public and the patrons on these emerging technology platforms. We are also seeing an uneven distribution of the demographics using the kiosks and the device loaning services. So for the kiosks, we're seeing 67% are men and 71% are white, and almost all identify English as their primary language. And then for the Chromebooks and Wi-Fi hotspots, a little similarly, 60% are white, but only 27% are men, and still almost all identifying English as their primary language. So as a result of that, we're focused on more of a grassroots marketing approach moving forward. And this includes talking about the initiative at places of worship in the community, bringing this up to community leaders and influencers within each community, and also going directly to community events. So next month, we'll have a table at the Hispanic Festival in Sussex County, which attracts thousands of people in the state. As expected, there is a wide variety of kiosk uses. This includes, outside of behavioral health and healthcare access, this is anything from employment, job interviews, job applications, meeting with lawyers, filling out Medicaid applications, checking on unemployment. So with that in mind, we are focused on partnerships to provide wraparound support and social determinants of health. So not just healthcare systems, but looking at forming partnerships with Department of Labor and people who can provide that support. We also see that people are heavily using the devices for entertainment purposes. And while we're not going to say you can't check those out for that, it tells us that there's an opportunity here to embed learning and services into entertainment. So there's a lot of platforms out there where people can learn about certain social services and healthcare information in the form of an activity or entertainment. So we're conscientious of that moving forward. Just in terms of quantity, more people are interested in the Chromebooks and Wi-Fi hotspots than the kiosks, which are stationary in the libraries. So that tells us that we should also be considering services at home in the form of mHealth and other social services, with the libraries more so as information hubs and leveraging our healthcare system partnerships. So yes, while the kiosks are still important for people, if they want to seek care while they're in the library, we are seeing a lot of people want to be able to use those services in the comfort of their home. So I wanted to leave this with some final thoughts. And we've been at this for officially in the telehealth capacity for over 2 years. But with the deployment of the kiosk and the devices, really 6 or 7 months. So far we're seeing breaking the mental health stigma is difficult, even for public libraries. We went into this thinking that, and we still believe that public libraries are stigma-free spaces where people can frequent to access these services. But breaking the mental health stigma is an enormous battle. So we are still working on that. Also changing the public's perception about libraries. We constantly say the public libraries are not just about books, but that does take a paradigm shift in the public's view towards what libraries offer. Like I said in that last slide, people are interested in accessing health and social services, and we believe that from the comfort of their home. So looking at ways to offer these services in the brick and mortar library, but also remotely from their house. A program like this really relies on partnerships. And so in addition to Christiana that you've heard from, and you'll see in a next slide, we rely on a number of people from the community to really make sure that this is successful. We want to have all people at the table when we're developing this initiative. And then I sort of throw these 3 adjectives in here that really define how my team is able to be successful and innovative in this process, and it's adaptability, empathy, and creativity. And I did just want to name a few members of my team because I know they're on here. Alta Porterfield, Annie Norman, Brian Dugas, and Ben Logue have been extremely supportive. This is not a one or two man or two person show, and I really appreciate their support with this project. So like I said, this is not a one organization show either. We have a number of partners from the healthcare space, from insurance, from nonprofits to government organizations. And I also wanted to highlight at the bottom here the 3 kiosk participating libraries: Laurel, Milford, and Seaford, all located in that southern part of the state that you saw in that previous map. And then lastly, thank you to the funders. This project, we were able to raise over $600,000 to support the first year of this project. So an innovative project of this nature really takes the support of innovative funders. So I just want to give them a shout out. And I should say that while the kiosks are at 3 libraries and the services are at 3 libraries, we are planning to go statewide later this year. So with that, I am going to open it up to questions, and I believe Anita has been looking at the Q&A.
I think Dr. Patel had already answered the question about what kind of training education do the navigators have. The next question is transportation to a library an issue?
It depends on the location. There's some interesting things that are happening with DART, which is our public transit system, where they're exploring these micro transit options similar to like Uber to provide people easy access to places like the library. We also have, Vishal, you can talk more about this if you're familiar. If you're a Medicaid recipient in the state, you can have transportation to medical visits.
Yeah, and we have there are a couple of these companies in the marketplace. The one that we've partnered with from an organization standpoint is a company called Round Trip. So they're essentially a convener of all the local transport companies. So it depends. Oftentimes it could be funded by the patient or by the facility that's taking care of them, or in this circumstance, it could be through some sort of grant for this library partnership. So you do have the ability to get sort of transport, but I think being that a lot of things can be done at home, we're really hoping that you may not need that transport, especially over time, if you're able to do a lot of like the care and the conversation in the home. But if transport's needed, there are a few different services that based on the patient's need. So if they're ambulatory and they're able to walk and you don't need a specialized car, then oftentimes Round Trip will just use Uber and Lyft. Obviously in some of the areas that are more rural, like you may have to wait a little bit longer compared to being in an urban area. But I think if you plan it ahead of time and you have a visit, 24 hours from now, and it's a planned thing, then these transport companies can be helpful.
Thank you, Dr. Patel. The next question is the state health department involved in this project? And if so, what has been their role?
Yeah, I talked about this a little bit in the PSA. Our Department of Health and Social Services has been involved in this wraparound service support since the onset of what we're doing in the library. So following, this was back in 2012, 2013, we started deploying social workers in the libraries with support of the Department of Health and Social Services. As it stands today, they still help us staff these navigators roles that we're talking about. So yes, it's extremely collaborative.
The next question is a comment as well as a question. Interesting that the kiosks aren't getting as much use. Does Delaware have pretty good broadband access across the state?
Yeah, we don't see it being a internet connectivity issue. The libraries have some of the fastest broadband in the state. And we were seeing people even use the parking lot Wi-Fi when the libraries physically were closed in the beginning of COVID. So I don't know if it's a connectivity standpoint. It's really just an education standpoint about what the libraries are offering. And again, we've only been at this with our marketing for 4 or 5 months. So it might take some time to have that, like I say, that paradigm shift in the community.
Next question is, have you run into problems with people needing to use the kiosks at the same time for ongoing services? If so, how do you handle this?
Not yet. So that's maybe one good thing about not being so heavily used right now. I will say the way we have the appointments set up is they are for an hour at a time, and we do have a half-hour buffer in between. That we started with that because when we were told we needed some time to sanitize between use when we were talking about COVID on surfaces. Now it's also just for logistics, because most people, if they have an appointment, it usually starts on the hour, the half hour, and you don't want, people on top of each other in the kiosk. So no issue so far, but we'll deal with that obstacle when we get there.
Another question is, what role did the public health department play?
And I think I already...
You kind of answered that already. Anything further?
Some other collaboration that we're doing, not directly related to this, but COVID testing kits in the libraries. And we're looking at ways to leverage the kiosks for other purposes like that.
Next question is, you said that the demographics are white male. What are the demographics around the library, or the demographics of library visitors?
Yeah, I don't have exact data on that, but from just looking and walking in the libraries, it's more diverse than that. So that's really the impetus for this pivot into really going into the communities and talking to community leaders. What we saw is really it's word of mouth that's incentivizing people or motivating them to use the kiosk. So if we can talk to the leaders of communities that really rely on word of mouth referrals, that's going to be ultimately the success.
Another question is someone who's saying that they don't see the question or answer regarding training of the patient digital ambassadors. How do you find people who are well-versed enough with tech and tech support, but who are also able to do the other parts of the job?
Great question. And I think we're still so new with this role, and we're learning as we're developing. So I think right now, we initially took a lot more, most of the people have some clinical backgrounds. A lot of them were either medical assistants or certified medical assistants. And then they've sort of learned, or we've taught through, the platforms we use and different super user training sort of internally on some of the tech support. But I think that may not be the strong suit. And then, we just hired 2 that had more of a tech / like administrative assistant background, and now trying to train up on just some basic medical stuff and what are basic immunizations and different tests and different screening tests and cancer screening tests. So at least they feel well versed when having conversations with patients. So I think we still haven't finalized the playbook, nor have we mastered it. But I think, from holistically from a patient standpoint, they want to go to one person and that person be able to address as many things as possible and get to resolution as quickly as possible. And what we were finding before, or just sort of current state in a lot of practices and a lot of these venues, is that you may have a question and then that person then will ask someone else, and it's, it may be like 2 or 3 steps or bouncing between 2 or 3 people to get to resolution. So we're, I think learning as we're doing, and I think one of the local universities, Wilmington University, is like helping us sort of put down our thoughts, which are sort of all over the place, into some sort of structure so that we have a structured playbook that we would be able to provide sort of the PDAs. But I think right now, what we've learned is that I think the main core attribute that we found in all, our sort of successful PDAs is really the flexibility, because no one day is going to look the same. So if you're someone that really wants structure, it's going to be a little bit more difficult. And I think having a little bit more flexibility will will allow that person to sort of succeed in that role.
Thank you. Nick, did you want to answer the question about the kiosks being wheelchair accessible?
Sure. Yes. So that they weren't. There were no ramps in the initial rollout of this, so we just got third-party wheelchair ramps to allow them to be wheelchair accessible. The picture you saw, I think, actually might have the desks all propped out, but you can actually collapse the desks, which does allow for a wheelchair to get in there and pivot.
One more question. This person is in Ghana. Most of the projects end at the pilot stage. What business models do you advise in such an environment? A key takeaway is the partnerships bit and the fundraising to sustain such projects, because most can't afford the data charges in some of the devices. Your thoughts?
So I'm going to answer how this works for us. It might be different in another country. My whole thought here was to find grant support to show a proof of concept for the first year of this project. It's not sustainable to always have and rely on grants, I believe, anywhere. So if we can then pitch this project to state government to pick it up and continue it, should we see the success, that's really how we envision the sustainability of the project.
And is there a problem with patients checking out supplies and not returning them or stealing them?
Like anything, when you're giving out, and we see this with library books and library media, we actually anticipated a 15 to 25% lost, stolen, damaged rate of all of our devices. And we went into this to overbuy all of our products. We talked to other library systems throughout the country that were already loaning out devices. And that was a common consensus of expect some to get stolen and don't be upset when they do. So that's where we're at.
And let's see here. Dr. Patel, do you want to answer the question about the resolution? If the visit can't be resolved with telemedicine, what are the next steps?
Great question. So majority of the time, at least for primary care, it can be done virtually with, some of the other biometric devices, but if unable to, then depending on sort of where that patient is, right? So if we are their sort of PCP, then, and depending on sort of where they are in time of day, we can help direct them to the right level of care. So if that means there's a local urgent care, and that's the right venue, if they obviously need a higher level and they need to go to the emergency room, then we can obviously direct them there. So we have the ability to sort of direct them based on where they are and us knowing sort of what's around there. Obviously over time, it would be great to develop, as we sort of scale to other states and other things like that, to start developing relationships with local groups. But it just becomes a little bit more difficult from a coordination standpoint. So using, the urgent cares, emergency rooms, it may not be the ideal state what we want to do, but we feel that we have the ability to deflect the majority of them away from there when they're not needed, but when needed, we'll be able to bring them to the right level of care.
Thank you. Nick, there's a question, are your kiosk navigators bilingual? Can you, to help assist the Latino populations? If not, what are the ways that you can support a patient that can't speak English?
Yes, good question. I forgot to mention all of our materials, all of our paper hard copy materials are translated for English, Spanish, and Haitian Creole, the three most predominant languages in Delaware. And our website is also easily translated. The navigators are not all bilingual, but we have representation from all of those three languages and are available for on-call support should somebody need translation.
All right. Let's see, I'm checking the chat box. And I think we have answered everything thus far. Well, thank you, gentlemen. Thank you, Nick and Dr. Patel. And appreciate you taking the time today, particularly Dr. Patel with a busy clinical schedule. And to answer, people have put up again, we are going to have a recording that'll be available and it'll be sent to the link that you signed up for. Our next webinar is going to be Telehealth Implementation, a guide and case study for critical access hospitals. It'll be put on by the Northwest Regional Telehealth Resource Center. This will be September 16th, 2021. And you can check the NCTRC website for the upcoming webinar. I would ask that everyone please complete the survey for us to understand what you found helpful so that we can do things like this going forward with someone understanding what you like. And I appreciate everyone joining us today and wanted to thank particularly Nick and Dr. Patel for their time again.